You are watching the Doctalk show.
Eye disease in diabetes can be prevented. Yes, you can save your eye from getting permanently blind in the event that you have diabetes. How can we do this? Our experts in the studio are here to tell us more about how you can prevent your eye from developing disease due to diabetes. So, Dr. May, prevention is always better than cure. It will always be the song sung every day for most diseases. Almost all diseases, they say prevention is far better than cure. How can we prevent people from getting diabetic eye disease? The disease due to diabetes affecting the eye.
Yes, the first thing really is to not to have the diabetes at all. Prevent diabetes in your body, in yourself.
How does
And
do that?
those are the basic things that we're talking about. We are leading a lot of sedentary lifestyle. You know, you come from your car, from your home into your car to your office, and from your office into your car to your home, and then take a few beers here and there, chips, chicken, you know. So all of that sedentary lifestyle actually can progressively lead to diabetes.
Because of no exercise.
Yes, no exercise.
And we're eating badly.
And we are eating badly. And so all these things are taking us slowly to getting diabetes. And smoking, the foods that we are eating, alcohol, no exercise, you know.
Eating so much high sugar.
Chocolate.
High sugars,
Like
Yeah.
which ones? The cakes, the ice creams.
the sodas, the cakes.
All those
and
refined
also
sugars.
the sugar itself we put in tea.
In that, yeah.
So all those,
They're slowly
can
leading
easily
us to
propagate
diabetes.
to diabetes.
Yes.
So people have to watch what they eat to
Yes.
prevent themselves from getting
From,
diabetes.
so the bottom line is to prevent the diabetes itself, because you see it is the root, it's the mother of this diabetic eye disease. So if you don't have the diabetes, there is no way you get the diabetic eye disease. However, if you have already diabetes, there are things that they recommend the patient to do: the regular exercise, stop alcohol, stop smoking, weight, do exercise. All of these things help to put the diabetes down a little bit on a lower end. If you're a patient, you need to have a regular visit to your physician, and also have your sugars well controlled. Really, we cannot emphasize this more, because if sugars are not controlled and are consistently high, the chance, the chance actually goes very high of
It
getting
means
the
you're almost
diabetes.
sure the eyes are going to
Thank you.
get spoiled.
In a very short time. Yes.
you do realize that diabetes is cutting across many specialties of medicine. The physician or the endocrinologist is busy managing the sugar, but the patient might be developing eye. So the doctor, the primary doctor, or the person who saw the patient first should have time with the patient and explain them that, yes, I'm managing this, but there are other things I should. So there should be a collaboration between the eye doctor and the physician who is managing the diabetes, so that at regular intervals, the doctor should refer the patient to the eye doctor to screen for diabetes, and the eye doctor, what he has done, should be able to communicate to the other doctor, so that the communication is a two-way, and we help the patient achieve the best control over time.
If the sugar is not really controlled, we usually counsel the patients. We find out, are they taking the medicines well? What is happening? How is the diet? Are they doing some exercise? Why is the sugar not really
I think
controlled?
at some point the patients get bored of the treatment, probably the injection, and then they tend to give up. Or some of them would get some herbal medicine and start taking that, and they give up. By the time they come and they take maybe the herbal medicine for a spell of a period, maybe 6 months, and during that time the sugars are in the sky, and the time and they come actually to the eye to the eye clinic because they're saying, "Doctor, I'm losing my vision." And still, when we go back to the ground zero, it is still the diabetes. And it's really frustrating that they have lost a lot of time and they are losing their sight. And of course, all the other body organs are being affected. Yeah.
So do not lose your sight to diabetes. Do not get do not be ill-advised to take other medicines other than the medicines for diabetes, because it is the control of your blood sugar that is going to save your eyes.
Yeah.
If you do not take the medicines, if you do not do what the doctor is asking you to do, if your sugars are not put in check, the blood pressure is not controlled, the weight is not addressed,
Yeah.
all these propagate to eye disease and can result in
Blindness.
permanent loss of the vision, which is what we don't want. And that's why we emphasize good control of diabetes. So,
diabetes is a very big problem, and if we do not work around it, it leads to blindness. So let's check our eyes. Let's screen for diabetic eye disease regularly as given to you by the eye doctor, and make sure that the advice given, you follow it up to make sure that the diabetes is controlled.
okay.
It would be better if we prevented the diabetes, but if we have gotten diabetes, then we work along to control the sugar.
Establishing the good control
of sugar.
Okay.
In addition to what Dr. Dan is saying, to the health fraternity first, whenever you see a diabetic patient, even at first diagnosis, you need to tell them about the complications, that it's a disease that affects the whole body, all parts of the body. And fortunately or unfortunately, in the eye, we can be able to see that they're actually bleeding vessels. But if we see bleeding vessels in the eye, then that means it's happening everywhere. It's happening in the brain, in the liver, it's happening in your spleen, it's happening in the kidney, it is affecting the feet, everywhere in the body. So as in the eye, it's actually showing us a real picture of what is happening everywhere. So to the health worker, let us send the patients for screening, because we do not want our population, these people who have diabetes, to go blind. It is devastating, it's frustrating for someone who has been seeing for the last 40 years, and then for maybe the next 10, 40, 20 or 30 of your years you are blind. It's very devastating. So let us work towards controlling blindness that is caused by diabetes. And you know, it's not reversible, doctor. As
it's
long
not
as
reversible.
no,
If the damage has happened, it's
as long as the
actually
damage has
permanent.
happened, that is it. End of chapter. So to our patients, we need to really take good care of our lives such that we do not go blind. Because at the end of it all, really blindness will come if you don't do anything about your health and your eyes.
Okay, so thank you. You've heard
Thank
it
you
from the
very much.
experts themselves. You must always have an eye check. If you're diabetic, go for your eye checkup and make sure you get diabetes under control with the help of your doctors. That will save your eye. All right, your eye is a very, very important organ. You cannot afford to lose your sight simply because you didn't do well in controlling the diabetes. I think that's the main key message, to go for early screening and to get the diabetes in check. And even the third point is, for those who do not have diabetes, do not get diabetes, okay? Because it's a very, very, as I've discussed, a very devastating disease. So you know all the risk factors. Make sure you save yourself from getting this very, very dreadful disease. And now we're going to take you through a video of what exactly goes on in the hospitals, because some of you are wondering, this laser therapy, this surgery, how exactly is it done? So I'm going to show you a brief preview of what goes on in one of the eye clinics within the hospitals in Kampala.
You are watching the Doctalk Show.
Previously, we had talked about diabetic retinopathy. So in front of me, I have a patient whom we are going to treat diabetic retinopathy or diabetic eye disease for laser. So this machine I'm seated in front of it is a laser machine. It helps us to burn or to seal those blood small vessels in the retina so that we stop the progression of diabetic eye disease. So what we do is we put a patient on a machine and then we deliver the laser. Nyabo, osobola kuteekawo n'akalevu. Yeah, it's okay. So we put the machine on the system like that, and then we apply lenses. Okay, just open. Just open. Just look up, up. Don't fear, don't fear, don't fear. Yeah, like that. And we focus. So we focus and deliver the laser. And that is what we do exactly.
You are watching the Doctalk Show.
Insights from a malaria specialist, Dr. Maya Lugemo.
Of course, it manifests with a lot of symptoms, but fever is the main cardinal symptom. Fever is the main complaint of any patient, but there are other associated symptoms like headache, joint pains, loss of appetite, diarrhea, vomiting, and to some extremes, especially in children, convulsions, loss of consciousness, sometimes delusions, and so many other manifestations. Well, just like it takes most of the blunt in HIV, if you looked at the map of Africa, HIV is more rampant south of the Sahara, around that area. But also poverty is around that area, low education, all these things that really come, because malaria is both a disease of poverty, ignorance, and other manifestations.
You are watching the Doctalk Show.
The Doctalk Show profiles Uganda's healthcare sector.
On the Doctalk Show today, we profile the Chirudu General Referral Hospital. Sticking out like a marvelous concrete jewel is the now famous Chirudu General Referral Hospital that came in handy when Mulago was undergoing renovation. It is located in the neighborhood of Boziga Hill in Machindia Division, and it cost a whopping 37 billion Uganda shillings, thanks to a government that is evidently committed to the health of its people. As Dr. Sentongo narrates, the burn and plastic surgery department that he heads is only one of the several excellent departments at your disposal when you pay them a visit.
We receive all the patients with burns and plastic surgery challenges that have failed to be managed in the whole country. So burns and plastic surgery unit is a specialist unit at the National Referral Hospital. On average, we see about 1,500 patients. We admit about 1,500 patients in a year. But the reason is that we don't have capacity to admit all the patients that would have benefited from all the services that we offer to all the Ugandans. Whereas burns comes out as the most outstanding, we handle those people who are born with deformities that are not acceptable in society. Children born without noses, children born without lips, people born without digits, those come under the plastic surgery department. We also handle other traumas, that is injuries on the road where limbs are lost, where skin is extensively lost. Those who have lost a lot of tissue that require replacement also come to us. And then a very small percentage of Ugandans who want to look better than they were born, called cosmetic surgery. When it comes to capacity in terms of theaters, Chirudu gives us capacity of 6 operating rooms. That, anywhere in the world, is good enough to handle much of the volume that the country is producing now. When you talk about a hospital, the services in a hospital, and I would be happy that the public understands this, that the hospital gives you medical and nursing care as a service. The hospital also gives you medicines and products of medicines, which are products. The hospital also gives you hotel accommodation, because when you're given a bed which is cleaned and a bed which, a room which is cleaned, which is lit, that is hotel service in a hospital. I've had people complain that there's nothing in government hospitals. When they're on a clean bed, when in a clean environment, already service has been offered, isn't it? What they complain about is the medicine, but medicine is just one of the components of the care. The fact that a nurse comes and greets you in the morning, doctor greets you in the morning, and finds out what the problem is already a great service offered to you, not only the medicines. And I think the public should appreciate this. So when you add up all this, that electricity is paid for, water is paid for, cleaning is paid for, a bed is paid for, before the medicine comes, already a lot is offered free of charge. It depends on the resources available and the population. And it's very difficult to predict how much you're going to consume. When we started, our average admission was about 300 people in a year. Now we are talking about 1,500 half year through. So we are likely to have more patients admitted. And yet the budget that we are running was passed some time back. So it means that at any one rate we shall have a deficit. And if a patient is required to top up on that, we should appreciate that. Otherwise, the services in government institutions are free, and they're especially free when they're available. If they're not available, we find a way of cost sharing, but they're essentially free. Band care anywhere in the world is a very expensive venture, because whatever we use is specific for the condition and for the patient. And it is an inevitable venture. When somebody has been burnt, you have to replace the skin. And this skin, you don't go to a window and get it. You have to make sure that you find a way of replacing the tissue that have been burnt from the tissue. We have to make sure that this patient has adequate nutrition. You have to make sure that the patient is propped up to survive. Sometimes you have to go to the extent of breathing for that patient, making sure that the heart works for that patient, because burns vary and they are very destructive. So the cost in our unit is very high. If you ask me what would be the cost of an average burn patient, it's about 50 million per patient for a severe burn. 50 million. And I know there are not so many Ugandans in this country who would survive if it wasn't for government input in this. So we should appreciate it. It's very expensive, but because of government support, we are managing. There are some people who come to us because of injuries that are beyond their control. A car overturns, the skin gets ripped off. There are people who have been born with defects which we need to correct. Probably nothing much can be done. But talking about burns and diseases of behavior, like diabetes and the wounds, we should be careful about what we eat. We should be careful about the environment in which we live. The majority of the children, of the burn patients we get are children, and these are children under the age of 15. And almost 85% of them burn in a homestead, where adults are, and where adults have not thought beyond the general thinking that the burning can cause damage to the children or injure the children. There should be a separate cooking place from a playing place, from a sleeping place. But because of restrictions in cost, maybe, people cook on their veranda in many of the slum areas and many of the hiring places. And that's where the children play from. Until you separate the fire from the playing ground of the children, chances are that the children are going to get burnt. The cost of a burnt child is much more than the cost of changing the environment to protect them from the burn. So let us stop it. Let us prevent it. Let us think through. Let us not just wail about our living conditions being bad. There's a lot we can do to make them better. There's a lot we can do to prevent the burns.